Hello, today we are going to be presenting Women's Therapy Clinic. Our mission statement is to provide holistic, compassionate care for women at every stage of life, specializing in pelvic floor health, mental wellness, and overall well-being through expert occupational and physical therapy services. In our presentation, we are going to first understand the issue, then explain our business concept, our business plan, our competitive edge, then explain to you why you should invest, and then tell you our summary of our presentation. So why is Women's Therapy Clinic needed? Several reasons. First, pelvic floor disorders impact 25% of women in the United States. This can include incontinence, pelvic organ prolapse, and more. With pelvic floor therapy being a specialty area, it is more difficult to access and lesser known to women who may benefit from its services. On the other hand, 1 in 5 women, which is 19%, experience a common mental disorder, such as anxiety or depression, and women in poverty are more likely to face poor mental health. With high prevalence of pelvic floor disorders and mental health disorders, the Women's Therapy Clinic will be there. Women's health is a prominent area of healthcare and incorporates women's physical and mental well-being across the lifespan.
Some services that will be offered are under the conditions of incontinence, pelvic organ prolapse, mental health conditions, pelvic floor weakness and pain, sexual dysfunction, postpartum related issues, postpartum and pregnancy related issues, surgical issues, overactive bladder, and more. Some treatments that will be provided are traditional occupational and physical therapy, manual therapy, exercise programs, biofeedback, bowel and bladder retraining, lifestyle changes, and more.
We created this logic model to give an overview of who our clinic is for, leading up to the outcomes and impact it will have. This clinic is for women of all ages and in any stage of life. It is also for the hospital system and our partners and stakeholders and investors. Some assumptions we had were from the research: pelvic health impacts 25% of US women. There is a need for pelvic floor specialty practice. There is also a need for women's mental health services. It also will connect women to one another and needed resources so that we can foster a sense of community. And improved access to specialty services will improve hospital satisfaction metrics. The process for achieving our outcomes and impact will include providing pelvic floor OT and PT services, providing mental health services, providing women's general health and wellness services. We will also have telehealth options, providing accessible women's health products to clients, and creating women's empowerment groups to build community and promote mental health. Our outcomes will be that women will receive needed services to promote their well-being. There'll be decreased wait lists for women's health services and improved patient satisfaction scores, all contributing to the impact of increasing overall occupational performance, improving mental health for women, and building a sustainable community consisting of women who support one another.
So our business plan overview. Starting off, our staffing and team will include an interprofessional team of pelvic floor certified OTs, PTs, and OBGYNs for referrals. And our leadership will include a CEO, COO, and a nonprofit grant/funding team. Our resources needed will be a therapy space in a hospital system that is private, quiet, and large enough for our sessions. Our working capital will be needed to cover salaries, our therapy space, and operations during the first 6 to 12 months. And then we'll require various equipment and supplies for our therapy sessions. Our service delivery and oversight includes that our therapy staff will provide all of our clinical supervision, outcomes, satisfactions, and productivity will be tracked and then reported to hospital administrators for quality assurance and growth. And then our revenue Our target revenue source will be from our hospital partnership to provide subsidized rent, shared resources, and that referral pipeline through the OBGYNs. Our clients will provide payment through insurance billing and private pay based on an income sliding scale. And we'll also use grants from health and women-focused foundations. Corporate sponsorships may be obtained through local health companies as well to assist in our revenue. So continuing on, for our desired grant, we would like the Office on Women's Health grant, specifically the Women's Health Innovation Community Engagement Grant. This grant is available and it's for nonprofit businesses, which we are, and especially as one addressing women's health, equity, mental health, specialized care services. We qualify for this grant because pelvic health and mental wellness are both core areas of the OWH. And then for our budget, during the first 3 months, we plan to not have any revenue. We're going to focus on setup, hiring, credentializing with insurers, hospital partnership development. During month 4 to 6, we're going to start our revenue stream through insurance reimbursement and private pay through that sliding scale of payment from clients for services. And then by our first year, we will be steadily increasing our revenue from insurance billing, group sessions, and telehealth expansion. And then our year 2 goal is to reach financial sustainability through a blend of grants, insurance billing, and private pay.
Understanding our competitive edge means to understand the need at hand for this business. Pelvic floor and women-centered care is a specialty area that is needed in the greater Kansas City metro. Pelvic floor therapy services are showing strong benefits to promoting health as this area continues to grow. Having this type of clinic near an OBGYN's office is essential for access to women's health care. We will promote through flyers and word of mouth at the OBGYN clinic, as well as utilize the hospital's marketing strategies and marketing team. Providing access is important to our team, which is why we will accept most insurance plans along with a sliding pay scale for those without insurance. To serve a greater population, we will also provide telehealth services to rural parts of the state. To measure success and provide quality control, we will obtain quantitative data through patient satisfaction scores, measuring the distance patients travel to the clinic, and the amount of referrals to care that are received. Qualitative data will be collected through factors such as access to services, pelvic or women's-based continuing education credits for the therapists, and continued approval of hospitals' leadership and stakeholders. This will provide us with data that we are able to analyze to use to ensure the continued quality for our clinic and our patients served.
So why should you invest in this business model? This business model is strategically organized through hospital partnership, which creates a pipeline to resources and care providers and will reduce operational costs and allow for sustainability. This also creates connections with additional organizations, grants, and donors who will contribute to this meaningful cause. This allows for powerful and evolving social impact, which you can also be a part of by investing in our business. We also have high potential with this initiative, as it is an area in healthcare where we have established there is a need with large opportunity to advocate and care for women's pelvic health. Being in the space of women's health, there is abundance of opportunities to grow this initiative outside of just pelvic health and expand resources to contribute to women's empowerment. Investing in this business model has positive social impacts and creates long-term partnership, as these needs will continue to exist for women. Investing in this business model not only contributes to improved health outcomes and increases access to care, but it also aims to break stigma surrounding intimate women's health and advocate for well-being of all women. Being a part of this initiative shows your commitment to women's empowerment. In summary, our mission and vision is clear. We want to provide access to compassionate specialty care providers, specifically in areas of pelvic health and women's overall health and wellness. We established in this presentation that there is a clear need for these services and a gap in their accessibility, as well as an awareness for women's pelvic health. Pelvic floor therapy is a specialty area for physical and occupational therapists, and specialty services can have more barriers to access. We aim to break down those barriers and provide the specialized services that women need. We also reviewed in this presentation our plans for staffing, resources, and revenue through a hospital partnership. Then we addressed marketing and budget plans with our desired Women's Health Innovation and Community Engagement Grant and our ability to market this nonprofit through our hospital partnership and their marketing strategies. We explained our competitive edge and our quality control by following patient satisfaction scores and overall accessibility. We will use this data to keep this initiative top quality, sustainable, and to ensure that it is having the intended positive impact for patients and the care providers. Thank you for listening to our presentation on our Women's Wellness Clinic. And these are our resources.